Good afternoon, and thank you for joining us at our virtual news conference. As we reported earlier this week, we've seen an uptick in the COVID positivity rates at our AdventHealth CentraCare urgent care clinics. We wanted to give you an opportunity to have your questions answered before the holiday weekend. So today we have Dr. Vincent Hsu, AdventHealth's Executive Director of Infection Prevention and Hospital Epidemiologist, with us. He will make a few remarks and then take your questions. Media are invited to text their questions at 407-490-3075, and please state your name and outlet when you do send that text. Again, the number is 407-490-3075. Now, this phone number is only available during this live media briefing. If you're watching a replay, please do not text in your questions. This number is not monitored at times outside of this briefing. And now, I'll turn it over to Dr. Hsu.
Good afternoon. As of this morning, we have had around 120 patients being treated for COVID in our hospitals throughout Central Florida. This includes Orange, Osceola, Seminole, Lake, Polk, Volusia, and Flagler counties. And this compares to around 1,700 that we've had at the peak of Delta. So certainly we're in a much better shape overall. We're not seeing a surge in hospitalizations due to Omicron at this time. We've learned from previous surges, however, that the positivity rates at our CentraCare urgent centers can be a good indication that an increase in hospitalizations are coming. And so certainly we're not taking that for granted. As of yesterday, the single-day positivity rate at CentraCare was almost 27%. And that is significantly increased from just a few weeks ago when it was at 5.5%. So as a result, we're not taking any chances, even though we are not seeing a surge right now in our patient population from an inpatient standpoint. We are prepared. We're doing everything we can to make sure that we are prepared for a potential surge in hospitalizations. But probably the most important thing that we want to make sure that we focus on is what you can do to protect yourself. And while we do recognize that that vaccinations against COVID-19 are less effective against Omicron, they still do provide protection, especially with a booster vaccine. We know that the population in Central Florida and as well as in much of the United States, that boosters have not been given to the same degree that the first and second doses are. So we want to really emphasize the importance of making sure that if you haven't received that booster and it's been a few months since your first and second dose, that you go ahead and get that. We've learned that antibodies will wane over time, and so having that boost is absolutely critical to boosting your immunity. We only found about 4% of positive cases at CentraCare were among people who already had the booster shot. So the vast majority of patients have not received that booster. We want to make sure that they do get that. So the most important message is really get your booster shot. It will help protect against Omicron. And certainly I do want to make sure that as the holidays continue, that we do other things that we know are going to help protect you against infection, because we recognize that vaccines are not 100%. Again, making sure that when you're in public that you keep your distance from other people whenever possible. Wearing a good fitted mask or double masking can certainly also reduce your chances and help with ensuring that you'll have a very safe and happy holidays. And with that, I will answer your questions.
All right, thank you very much, Dr. Hsu. The number to text your questions is 407-490-3075. Again, 407-490-3075. Our first question comes from Kristen from News 6, and she asks, how effective are monoclonal antibodies when it comes to combating the Omicron variant?
So we have seen that the Omicron variant, with its myriad of mutations that have occurred, are less effective to some of the monoclonal antibodies that have been given. This includes the Lilly product, which is the bamlanivimab, etesevimab, as well as the Regeneron product, REGEN-COV. And so we recognize that there are limitations to that. There is one monoclonal antibody that appears to continue to have effectiveness. That monoclonal antibody's name is called sotrovimab. It's made by GSK. And certainly, we want to make sure that we provide the best monoclonal antibodies possible. But one of the issues that we are limited in right now is that there may be shortages of monoclonal antibodies, and we are continuing to work with the state to make sure that we get the ones that we can that are effective to provide treatment for our patients.
You touched on this briefly, but that's the second question, is why do you think there is a shortage of monoclonal antibodies, specifically Regeneron?
Well, we're seeing a lot of demand now. We know that the percent positivity rate has shot up. We know that the community spread in the Central Florida area has gone up. And so as a result, the public is also more aware about the benefits of monoclonal antibodies. So there's a lot of demand for that, and this is an issue where demand outstrips supply. Again, continuing to work with our public health partners to make sure that AdventHealth continues to have the monoclonal antibodies to treat these infected patients is really what we want to try to do.
Next question, can the rapid tests or the at-home test detect Omicron? How reliable are they, or should people be getting a PCR test instead?
The rapid tests are reliable. The FDA has a list of sorry, I'll start again.
That's okay.
No, the rapid tests are reliable. The FDA does have a list of the rapid tests that work, and they include the vast majority of what's available on the market. So I'm very confident that rapid tests are there. Rapid tests are most reliable when you're testing early in the course. So if you start developing symptoms, get tested with a rapid test. It really is very good at detecting it. PCR, of course, is as well. So I am not worried about diagnosing it. If you have a negative test, then it's probably something else. And there are other viruses circulating around, such as influenza.
Next question comes from Carolina Cardona from WKMG, and she asks, should people have the same concerns with Omicron like they had with the Delta variant?
Well, we know Omicron is more transmissible. And we also know that people who have had full vaccinations, have been fully vaccinated, are at greater risk of developing what we call a breakthrough infection. So in this case, it is important to be as careful as possible, especially now that we are in the holidays. So as mentioned, if you've gotten your full dose and you're fully vaccinated, get that booster. That is one very important step you can do to help protect yourself. And at this point, I would continue to wear my mask whenever I go in public places. Keep your distance. I remember the days before the vaccines were available. That's what we did, and it worked. And I think that is another very important step that you can do, again, to make especially the holidays as safe as possible.
Next question comes from Brianna Ardonando from WTVT in Tampa. And she asks, since Omicron seems to lead to milder infections, does this mean you expect less COVID patients in the hospitals? And how is Omicron changing the number of vaccinated versus unvaccinated